Hello, everyone, and thank you for tuning in to IFFGD's Research Award Winner Series, Where Are They Now? This program was designed not only to acknowledge this year as being IFFGD's 30th anniversary, but to also give us a chance to reconnect with some of our past Research Award winners. Today, we have the pleasure of speaking with Dr. Spiegal, who is our 2007 IFFGD Research Award winner for Junior Investigator in Clinical Science. Thank you so much for joining us today, Dr. Spiegal.
Thanks for having me. Appreciate you having me back.
Yes, it's always a pleasure to speak with you on any of your research topics. So can you actually just give us a little bit of your backstory, where you are located, and a little bit of your current research focus?
Yeah, well, you can see behind me is a picture of the hospital where I work. That's Cedar-Sinai Medical Center. When I won the award, I was at UCLA, and I still work very closely with UCLA. I am currently the Director of Health Services Research at Cedar-Sinai Health System, and I'm a professor of medicine and public health at Cedar-Sinai and at UCLA. And my research sort of spans many topics. I'm interested generally in of course, disorders of gut-brain interaction, or formerly functional GI disorders, irritable bowel syndrome, dyspepsia, abdominal pain, and also understanding some of the science behind mind-body interventions like virtual reality or VR, which I've talked with you about in some previous discussions, but also understanding how can we really acknowledge and measure the impact of conditions like IBS on overall health and well-being. So over the years, I've studied everything from how do we measure symptoms correctly so that we really understand as best we can what the experience is like, to understanding suicidality, a pretty serious consequence of chronic abdominal pain and GI symptoms, and published a paper on that. Many different areas around the social science and psychology of disorders of gut-brain interaction.
Yeah, and as many of us know, GI disorders can definitely impact the quality of life of many patients. So it is particularly important for us to research that area of how that impact does affect the quality of life. So
yeah, and just on that point really quick, sorry to interrupt, but that can't be overstated enough, because historically, funding for conditions like IBS has been relatively low compared to other conditions like inflammatory bowel disease or heart disease or many other conditions. And so the argument traditionally has been, well, IBS is sort of like a lifestyle condition. And I don't even know what that means, but that's a term I've heard. Or, it doesn't kill you, so, how bad could it be? And I've literally heard that. Like, I'm not paraphrasing. I've heard that from other doctors. And so part of my mission has been to really capture how bad it can be, so that we understand the burden of these illnesses, both the physical burden, the emotional burden, the social burden, and the health economic burden. So that's another part of what I do, is look at the cost effectiveness and health economics of these conditions.
yes, thank you so much for going into more detail about that. And so talking about some of your research, can you briefly explain a little bit about some of the current research topics that you're involved in?
Yeah, so right now, in terms of functional GI disorders, I keep calling them those, even though we're not supposed to. Now they're called disorders of gut-brain interaction. Probably the virtual reality research is the area that's most active, and we've talked a bit about that. I don't know if everyone listening to this particular discussion have heard all that, so I can just briefly touch on that, maybe refer them to some of our extensive conversations we've had separately. But we know from work from Emmer and Mayer and others, and I know Dr. Mayer has also participated in this series, that conditions like irritable bowel syndrome are definitely caused by abnormalities in the gut, whether it be microbiome or diet, but also by the way the gut and the brain communicate back and forth. And so this brain-gut interaction, or brain-gut axis as it's called, is an area that we've always been interested in my group. And I having trained at UCLA with Emran Mayer, learned a lot from him about what happens in the brain. So we use virtual reality as a very accessible technology that a lot of people have sitting around in their house because maybe they got it for their kids for Christmas or their kids use it for games. But we can use virtual reality to tap into that mind-gut connection. And right now, as we're talking, in fact, my team is working on a new virtual reality treatment for irritable bowel syndrome specifically. And we're well into it. We hope to have it built and completed sometime in the next, 6 to 12 months. And the idea is that, we know that cognitive behavioral therapy can help alleviate some of the symptoms of IBS. It may not cure you, but it can certainly help. And for some people, it even can almost cure. But it's hard to get access to mental health experts who know about IBS, and also to have the training at home. How do you really learn how to do biofeedback training at home? So we're working on ways to use virtual reality to embed yourself in these fantastical worlds where you fly through your body or your gut and you get biofeedback training. And I'll tell you more when we have that, how we actually do that. But this is an example of where my lab has gone since getting the IFFGD award 13, 14 years ago, is really figuring out how can we leverage technologies that are readily available now to help tap into all that basic research that people like Emran Mayer and Lin Cheng and many others have done to try and provide clinical benefits, right here and right now. So it's not theoretical anymore, it's actually tangible and available.
Yeah, and for anyone who is listening, we do have the virtual reality podcast available on our YouTube channel that we previously did with Dr. Spiegel, where he goes into more depth about the virtual reality and the research behind it and what he's involved in at UCLA and at Cedar-Sinai. So thank you so much for giving us some backstory about that. And can you also just kind of explain just a little bit more into detail about what you hope to understand more by using virtual reality or any of these research studies that you are involved in? What do you hope to gain a better understanding of in terms of gastrointestinal disorders in adults and children?
So, VR is, what I'm interested in with VR is what does it teach us about our own consciousness? It's a very sort of philosophical question. I was a philosophy major, so I tend to go down these directions. But also, what does it teach us about the way the brain and the body connect to each other? For example, and I've written a book about this recently called VRX that, I think we talked about before. In that book, I talk about how I had a complete out-of-body experience in virtual reality. I disconnected from my body completely. And I looked down from the ceiling, and I looked down upon my body, and as if I had passed away. And it was really remarkable that my brain really felt like I had left my body, even though I knew, of course, I hadn't, but I was nudged into thinking I had. And so what does that mean about my brain and the way it works, that I can be convinced of something so profound?
Yeah.
And how can we use that to help convince ourselves about other aspects of our lives in a positive way? How can it be used to change the way we experience the world around us and the world within us? And that's where we start talking about, disorders of gut-brain interaction, and IBS, and abdominal pain, where, sure, we always look to see, is there an ulcer, or is there inflammation, or is there something we can treat with a medicine? But sometimes we can't figure that out. And we realize that the problem has something to do with the nerves and the way they're communicating back and forth. And it turns out we do have some control over that with our own brain. Our brain is part of that system. So we can use our brains to tamp down or reduce the signals that are firing, the nerve firings inside our body. And that's not some pseudoscience. It's real science. It's just one thing to read a paper about that, and then another to say, well, how do I do that? How do I actually do that? Do I take a medicine for that? Well, there are medicines that can help. But is there something I can do? Do I need to meditate? What do I need to do? And so what's been fascinating to me about VR is it's a technique, it's a platform that allows us to train people over and over again how to be more in tune with what's happening inside their bowels, inside their gut, inside their body, and literally to get feedback. Just imagine, and we're working on this, if you could hear your bowels through a microphone, and then the bowel movements and the sounds changed what you're seeing inside of a VR headset. And when your bowels are moving quickly, you see a river flowing very fast. And then you try to slow down that river with your brain. And then what happens is if you slow down the river, it starts to slow down. But what's really happening is you're actually controlling your bowel function, the movement of your bowels. And as a result, you also can reduce the amount of signals going back and forth between the brain and the gut. But it takes practice to do that. And it's one thing to say, oh, go become a monk and learn how to meditate in a cave somewhere. No one has time for that. So what we're trying to figure out is how can we support people with IBS with virtual reality in addition to all the other treatments available, not as some substitute for antibiotics or for diet or for all the other ways people are trying to help IBS, but to augment those therapies with effective cognitive behavioral therapy. And now more and more people with COVID are at home and in quarantine and don't necessarily have access to their doctors or have access to mental health experts who are trained in cognitive behavioral therapy for IBS. So we're working with our psychiatrists and computer scientists and graphic designers to create a home-based VR CBT treatment protocol. We're really excited about it.
Yeah, no, I'm excited to hear about that as well. And I think that technology has just come so long, so far. And it's just amazing to hear how we can incorporate using technology at home or in healthcare practices just to help patients cope with their GI symptoms. I think it's phenomenal to hear the research and how much it has grown in that area. Speaking of research, what would you consider being your most successful research study and why?
That's hard to answer. Not to sound self-important or anything, but at this point I've published about 225 studies, so I'm trying to think about which one is the most impactful. It's interesting. I can answer that in different ways. One of the most impactful, there's a few that come to mind. Maybe I'll just one of them that still to this day gets talked about a lot, and I published it probably 15 years ago now, I don't know, something like that, was a study where we looked at, should we be checking for celiac disease, when people come with a diagnosis of irritable bowel? And so we looked at that question many years ago, and we looked at it from a cost effectiveness standpoint, just from like an insurance standpoint. Should insurance companies pay for diagnostic testing for celiac disease? And would it actually make sense from a health economic standpoint? And so we ended up concluding that, celiac disease happens frequently enough that it's worth it, that you should make sure if you have IBS, particularly if you're having diarrhea, but not just diarrhea, but generally diarrhea predominant IBS, it is cost effective to test for celiac disease, and your doctor should do it. And that study ended up getting put into the guidelines. And to this day, the most recent guidelines that have just recently come out by the American College of Gastroenterology in 2021, all these years later, they still refer back to that study. So then I'm proud of that because it's a very simple, very pragmatic point, which is make sure to get tested for celiac disease and make sure you don't have that before you go down the road of IBS. So that was one study I'd say that I've done a lot of, that's been quoted a lot. Another study that we did that got a lot of attention, again, a very simple study, was a survey that we did, not of patients, but of doctors. And we actually surveyed some of the world's experts in IBS, members of the Rome committee that create the guidelines. Yeah. And we gave them vignettes or patient stories. We didn't tell them that this was an IBS survey. We told them that this was a survey about patient care. And we gave them patients who clearly had IBS based upon their own criteria, the Rome criteria. And we asked them, does this patient have IBS? And if not, what other tests do you need to do? And it was amazing to see how many people said, well, I'm not yet ready to diagnose IBS. I would want to do more tests. And these were the experts who had written the guidelines. They weren't really following their own guidelines. So what that brought up at the time was this question of, is IBS really a diagnosis of exclusion? And what we mean by that is, do we need to do a bunch of tests and rule everything out, like celiac disease, before we're comfortable that this is IBS? You know, we have to do a colonoscopy and check for celiac, check for cancer, check for inflammatory bowel disease. And once everything is negative, only then do you have IBS. Or can we really make a diagnosis of IBS proactively and confidently without having to do all of these tests? So that study brought that question up, and it's cited all the time, because I challenged back to the community that even the experts are having trouble following their own guidelines on this. Yeah. So that study has led to a number of other research studies to explore this question. And I don't know that I have a good answer for you today, all these years later, but we're getting better at figuring out what tests do we really need to do, and maybe what tests are a waste of time and are not useful to do when people have IBS symptoms.
Yeah, and I think that's really important, especially just to get down to the main cause and reason for these symptoms, and to eliminate the back and forth for patients having to come in and out of the office, and knowing that, I mean, some of these conditions can be very debilitating. So it can be challenging for them to keep coming in and out and to perform some of these practices while they're coming to see their doctor. So, absolutely. Yeah. So in talking about some of the research studies that you see as being the most successful coming out of your lab, what are some other research acknowledgements that you've received from other organizations or anything outside of the IFFGD Research Award in 2007?
Yeah, no, that was a big moment for me. I remember getting the award. It was in Milwaukee at the Art Museum, beautiful dinner, and I got called up, and it was a big moment for me. And you know, that was 14 years ago. And since that time, that award has really helped to establish my research career and led to a number of other grants and awards that I've received over the years. So I've been very fortunate to obtain funding from the National Institutes of Health, or NIH, both for the quality of life research that we talked about, and also more recently for the virtual reality research. So the NIH has sponsored our work. We've been fortunate also to partner with a number of pharmaceutical companies. And what I like about these partnerships is I'm not studying the drug. I don't do pharmacological research. So drug companies come to my lab when they want to understand more about the quality of life of people and want to understand more about, you know, is it cost effective to use a medicine? Or what's the best way to do a study to figure out if a medicine's actually working? What symptoms should we really be following? So I feel like our group provides a very important sort of service to drug companies beyond just testing the drug itself. And so we've received various grants over the years from a number of different pharmaceutical companies within the GI space, almost all of them, frankly, who are interested in like our, you know, contributions to this. And I like that because I don't have to take a stand on the medicine. I just can provide information on the patient experience best I can. And then, you know, we've received other types of funding from the American College of Gastroenterology. Been very fortunate to get funding from them, from PCORI, Patient-Centered Outcome Research Institute, and so on. So yeah, about, I don't know, 30 or more grants since that time. So been very fortunate.
Yeah, and that's awesome for just to have the support to be able to do the research that you are doing, because like you said, it is always important to bring in that patient perspective whenever you're doing the research, because ultimately patients are the ones living with these conditions. So hearing their voice and what it's like to live with it is definitely very important for those who are making the drugs to hear. And I think it is just a testament to all that you have done to get those acknowledgments and those awards, because honestly, funding is so important and it's hard to come by in this area of research. So, I mean, just to further along the treatments and better ways to help people cope with their GI disorders, funding is very crucial.
Mm-hmm.
So, what do you specifically enjoy about being a researcher?
Oh boy, there's so much to say about this. I mean, it's a real privilege to be in research and to be a physician who does research. And I say that because I still see patients, of course, not a lot, only a small percentage of the time, but there's a real honor to be in, you know, the 5% of doctors, let's say, that do research to help the other 95% figure out how to practice medicine. So there's a responsibility that comes along with that, to be as rigorous and as transparent and as evidence-based as possible. And also to be able to teach the next generation of researchers. And, you know, I'm not that old, but I'm turning 49 this year, so that's how old I am. But I used to be the young one amongst all the IBS researchers, and now I'm not. And I'm teaching other people about IBS and about how to study it. And so there's a real satisfaction that comes with sort of passing along knowledge. I think we all feel that in all of our different disciplines and jobs and lives and careers, is to be able to pass along that that information and know-how. And in research, it's especially rewarding because I can see that I train these young doctors and they go and they're doing research now too. So I feel like, you know, when I retire or when I'm gone one day, I will have left some research behind, some of which hopefully stands the test of time. And I will have left some students behind who are carrying the torch and continuing, you know, the circle of life. So yeah, that's my thought about the benefits and opportunities of research career.
Yeah, and your mentees just taking the torch and carrying out and furthering the research to, you know, just provide a little bit of light at the end of the tunnel there for many patients who are suffering from GI disorders. So we've talked a little bit about all of your research studies and things that you are involved in. And as we begin to kind of wrap this up, can you explain to us what you see as being some of the gap needs in research and how you foresee your lab fulfilling some of these gap needs in some of the future research studies?
Yeah, so, well, of course, one need is funding. You know, that's easy. We've talked about that. You can always use more funding in functional GI research, and the federal government has always underfunded it relative to the prevalence of these diseases and the burden of these diseases in the population. So that's an unmet need, generally speaking. You know, getting back to some of my earlier comments, I'm really interested in the sort of the cracks, I guess, the gap between the incredible basic science research and sort of theoretical research and animal research that's being done on the one hand, and like the clinical needs on the other. And how do we really translate them? How do we connect them? So, you know, I gave an example already of the virtual reality research. So, you know, there's incredible research already done for years looking at the brains of people with IBS, for example, and functional MRI scans and learning about the nerve signaling back and forth. And it's terrific. But again, you know, if I'm a patient and, you know, I do have family members with IBS, sometimes I really feel like I have to say, like, we failed them. You know, when a family member comes to me and says, well, that's all great, what do I do? You know, how do I get better? I'm like, oh, well, did you try this pill? Did you try that pill? You know, and sometimes the pills work, sometimes they don't. And it's really, you know, am I missing something? After all these years, have I missed something? I'm a gastroenterologist who specializes in IBS, and my own family member, I still haven't figured out, you know, why she's experiencing these symptoms. Am I missing something? So I have this feeling like we haven't finished this at all. And so that's where something like virtual reality is exciting to me, because I could say, you know what, we made a website. It's called virtualmedicine.org. And on the website, there's a link for programs that you can download to your VR headset. And I talked about how we're making a VR program. And not that that's the end all either, not that that's going to cure everyone either, but it's something I can say, listen, I'm working on something that I want you to try, and I hope it will help. So I'm trying to translate, in this case, mind-body research, brain-gut axis research, into a tangible, actual thing that can actually help people, but it's not a pill. Not that I have anything against pills, by the way, but it can help augment those. So to me, that's an unmet need, is trying to continue to connect the basic science research with actual clinical applications, whether it be a pharmacotherapy, a new treatment, or some other type of immersive therapeutic like virtual reality, augmented reality, mixed reality, or many other evolving applications that could be used to help alleviate some of these symptoms.
Yeah, and for many patients, they've tried many different treatment options and they've exhausted those ends. So just the fact that research is supplying us with a new area that we can focus on, and like we know, it's not a one size fit all for many patients. There's not one specific treatment that will treat everyone. So just providing another option like virtual reality that steps away from drugs and allows them to participate in something that is more connection with their body is just exciting, and it gives a little bit of hope to the future of those who are living with GI disorders like IBS.
Right.
Yeah, so thank you so much for all of the insight that you have provided us today in this program. And thank you everyone who has tuned in to IFFGD's Research Award Winner Series, Where Are They Now? Today, we've really had a pleasure of just catching up with Dr. Spiegal and understanding his journey through research. And, you know, as we mentioned before, there's plenty of other programs on our YouTube channel with Dr. Spiegal about COVID and how it affects your GI, about COVID Part 2. We have that as well about GI symptoms and on virtual reality. So feel free, and thank you again, Dr. Spiegal, for all you've done with IFFGD.
Appreciate it. Thanks very much for the award and for following up these, 13, 14 years later. Thanks a lot.
Thank you. And thank you for all you've done in the research community.